Have you ever noticed how simple things like coughing, sneezing, or even laughing sometimes cause small leaks of urine after 60? Or perhaps you've felt a heaviness in your lower belly that makes you worry about your bladder or uterus dropping. These changes are more common than most women realize, and they often stem from the same root, a weakening pelvic floor. The pelvic floor is a group of muscles and tissues that support your bladder, uterus, rectum, and vagina, almost like a hammock. Over time, with age, childbirth history, and hormonal changes after menopause, this hammock can lose strength. The good news: just as daily habits can wear down your pelvic floor, daily habits can also protect and strengthen it. Hello, I'm Dr. Lisa Perriera. For more than 30 years, I've cared for women through every stage of life from young adulthood to postmenopause. And one thing I know for sure is that your pelvic floor health deeply affects your confidence, independence, and quality of life. A strong pelvic floor means fewer leaks, more comfort, and better support for your organs. A weakened pelvic floor can mean embarrassment, pain, and even surgeries that might have been prevented. Today, I want to walk with you through 5 everyday habits that will help protect your pelvic floor after 60. These are simple, realistic steps you can start now, no matter your health history. Before we begin, I'd love for you to subscribe to Elder Care Wellness. Here we share practical, evidence-based advice to help women over 50 live with strength and confidence. If you've ever struggled with leakage or felt pelvic discomfort, share your story in the comments below. You'll discover you're not alone, and your words might give courage to another woman facing the same challenges. So let's start with the first everyday habit: practice Kegel exercises consistently. You may have heard of Kegels before, but many women don't realize just how powerful they are, or that they may not be doing them correctly. A Kegel is a contraction of the pelvic floor muscles, the same ones you use to stop urination midstream. By tightening and relaxing these muscles regularly, you build strength and endurance in the hammock that supports your organs. Research from the Mayo Clinic shows that women who perform daily Kegel exercises can significantly reduce urinary leakage and improve pelvic support, even decades after menopause. The key is technique. Many women mistakenly tighten their abdomen or buttocks instead of the pelvic floor itself. Imagine trying to gently lift a blueberry with your vaginal muscles. That's the subtle motion of a proper Kegel. Hold for about 3 to 5 seconds, then relax for the same amount of time. Aim for 3 sets of 10 repetitions each day. You can do them sitting, standing, or lying down, while brushing your teeth, waiting at a red light, or relaxing before bed. The beauty of Kegels is that they're invisible. No one knows you're doing them. Over time, they restore strength and control, making you feel more confident in your body. I recall a woman in her early 70s who came to me embarrassed by daily leaks whenever she laughed. She thought surgery was her only option. I taught her how to do Kegels correctly and encouraged her to practice for 3 months. When she returned, her face lit up. "I don't need pads anymore," she said. "I feel free again." That freedom came not from a complicated procedure, but from the simple, consistent habit of strengthening her own muscles. So the first habit to protect your pelvic floor after 60 is making Kegel exercises a daily routine. Think of them as brushing your teeth, a small act done every day that protects you from bigger problems later. In the next part of this video, we'll talk about the second everyday habit, maintaining a healthy weight, because extra pounds put extra pressure on your pelvic floor, and reducing that strain can make a world of difference. The second everyday habit to protect your pelvic floor after 60 is maintaining a healthy weight. Many women don't realize just how much extra pounds strain the pelvic floor. Imagine your pelvic floor like a hammock. The more weight placed on the hammock, the more it stretches and sags. Over time, that constant pressure weakens the muscles and connective tissues, making leaks prolapse and discomfort more likely. According to the National Institutes of Health, obesity is one of the strongest risk factors for urinary incontinence and pelvic organ prolapse in women. This means that maintaining a stable, healthy weight isn't just about your heart or joints. It's about protecting the very muscles that keep your bladder and uterus in place. When you carry excess weight, especially around the abdomen, your pelvic floor bears the brunt of it every time you stand, walk, or lift. The strain is even greater during coughing, sneezing, or physical activity. Over years, that pressure can cause the bladder or uterus to press downward, leading to prolapse, a condition where organs begin to drop into the vaginal canal. Many women assume prolapse is only caused by childbirth, but weight is a silent factor that adds stress long after childbearing years are over. By managing your weight, you relieve your pelvic floor of this heavy burden. Losing even a small amount of weight can make a real difference. Research from the New England Journal of Medicine found that women who lost just 5 to 10% of their body weight experienced a significant reduction in urinary leakage. That means, if you weigh 160 pounds, losing as little as 8 to 16 pounds could lighten the load on your pelvic floor and improve your comfort. It's not about perfection or becoming thin. It's about reducing the constant downward pressure so your pelvic floor has a chance to function properly. I recall a patient in her late 60s who came to me with bothersome prolapse symptoms. She felt a bulge and often described a dragging sensation in her pelvis. While surgery was one option, she wanted to try everything possible to avoid it. Together, we created a plan for gradual weight loss through healthier eating and gentle walking. 6 months later, she had lost 15 pounds. While she still had prolapse, her symptoms were far less bothersome. She told me, "I feel lighter, not just in my body, but in my pelvis too." That small but steady weight loss reduced her daily discomfort and gave her back confidence. Healthy weight maintenance also means focusing on sustainable habits rather than quick fixes. Eating whole foods, fruits, vegetables, lean proteins, and whole grains provides energy without excess calories. Limiting sugary drinks, processed foods, and late-night snacks can prevent slow creeping weight gain. Pairing this with regular movement, even simple walking or light strength training, keeps your metabolism active. Many women over 60 find success with small, steady steps, like replacing soda with water, adding a vegetable to each meal, or walking after dinner. Each choice may seem minor, but together they lighten the load on your pelvic floor. It's important to approach weight with compassion. Many women carry shame about their size, but shame doesn't help the body heal. The goal is not to chase a number on the scale, it's to protect your pelvic health so you can stay active, independent, and confident. Think of weight management not as punishment, but as giving your pelvic floor a gift, relief from strain. By keeping your body at a stable, healthy weight, you allow your pelvic floor to serve you better for longer. So the second everyday habit is maintaining a healthy weight to reduce pressure on your pelvic floor. Even modest weight loss can lessen leaks, ease discomfort, and lower the risk of prolapse. In the next part of this video, we'll explore the third habit, why staying active and moving your body every day keeps the pelvic floor strong and resilient, no matter your age. The third everyday habit to protect your pelvic floor after 60 is staying active and moving your body every day. Many women believe exercise is just for maintaining weight or keeping the heart healthy, but regular movement directly benefits the pelvic floor. Think of your pelvic floor as part of a team. Your core muscles, hips, and back all work together to support your organs. When you keep your body strong and flexible, your pelvic floor doesn't have to carry the load alone. But when you become inactive, those supportive muscles weaken, leaving your pelvic floor to do all the heavy lifting. Over time, That strain shows up as leaks, heaviness, or discomfort. According to the American College of Sports Medicine, women over 60 who engage in regular physical activity experience better bladder control and lower risk of pelvic organ prolapse. Exercise increases blood flow to the pelvic region, delivering oxygen and nutrients that help tissues stay strong and heal. It also helps regulate hormones and reduces inflammation, which supports overall pelvic health. Movement is not just about strength, it's about keeping the entire pelvic area alive and resilient. The key is choosing the right kind of exercise. High-impact activities like running or heavy lifting can sometimes put too much pressure on the pelvic floor, especially if you already struggle with leaks. Instead, low-impact options, such as walking, swimming, yoga, and Pilates provide strength without strain. Yoga and Pilates, in particular, target the deep core muscles that work hand in hand with the pelvic floor. Gentle stretches improve flexibility, while mindful breathing teaches you how to coordinate your diaphragm and pelvic muscles skills that protect you in daily life when you cough, sneeze, or lift something heavy. I once worked with a woman in her early 70s who had stopped exercising after her retirement. She noticed increasing leakage and felt her balance was declining. We started her on a gentle program, 15 minutes of walking each morning and 2 yoga classes per week. After just a few months, she proudly told me her leaks had decreased and she felt steadier on her feet. "It's like I found strength I didn't know I still had," she said. That strength was not only in her legs and core, but also in her pelvic floor, supported by her renewed activity. Strength training with light weights or resistance bands is also valuable as it helps build muscle throughout the body. Stronger muscles improve posture, which reduces downward pressure on the pelvis. Better posture also allows the pelvic floor to work in alignment, not under strain. Even simple bodyweight exercises like squats and bridges done correctly can activate both the glutes and pelvic floor together. I often teach women to exhale and gently engage the pelvic floor as they rise from a squat, training their bodies to support the pelvis during effort. The most important part is consistency. You don't need to spend hours in a gym to protect your pelvic floor. Just 20 to 30 minutes of mindful movement most days adds up to enormous benefits over time. Choose activities you enjoy, dancing in your living room, gardening, or joining a community walking group. The more enjoyable the movement, the more likely you'll stick with it. Remember, your pelvic floor thrives on circulation, flexibility, and gentle strength, all things that daily activity provides. So the third everyday habit is staying active with low-impact movement that strengthens the core and improves circulation. By keeping your body moving, you reduce strain, boost pelvic resilience, and protect your independence. In the next part of this video, we'll discuss the fourth habit, managing bladder and bowel health, because how you eat, drink, and use the bathroom has a direct impact on the pressure your pelvic floor feels every day. The fourth everyday habit to protect your pelvic floor after 60 is managing bladder and bowel health with care. Many women don't realize that the way you eat, drink, and use the bathroom can either protect or weaken your pelvic floor. Every time you strain to have a bowel movement or push hard to empty your bladder, you increase pressure downward on those delicate muscles. Over years, repeated straining stretches and weakens the pelvic floor, making leaks and prolapse more likely. The good news is that small changes in daily habits can reduce that pressure and keep your pelvic floor strong. One of the most important steps is preventing constipation. After menopause, slower digestion, less muscle tone, and sometimes medications can make constipation more common. Straining to pass hard stool is like lifting heavy weights with your pelvic floor. It places enormous pressure on those tissues. To prevent this, focus on a diet rich in fiber, whole grains, beans, vegetables, and fruits. Aim for at least 25 grams of fiber daily. Drink plenty of water to soften stool and keep physically active to stimulate digestion. If you still struggle, talk with your doctor about safe stool softeners. By keeping your bowel movements regular and soft, you remove one of the biggest stressors on your pelvic floor. Bladder habits also matter. Many women develop the habit of just-in-case trips to the bathroom going too often, even when the bladder isn't full. Over time, this trains the bladder to hold less urine and increases urgency, which puts pressure on the pelvic floor. Instead, try to urinate every 3 to 4 hours during the day and avoid pushing or straining to empty. Caffeine and alcohol can irritate the bladder, so limiting them may also reduce urgency and leakage. The Mayo Clinic recommends keeping a bladder diary to track how often you go and what beverages make symptoms worse. This awareness can help you make small adjustments that ease stress on your pelvic floor. I remember a woman in her mid-60s who came to me frustrated by both constipation and frequent bladder leaks. She often sat on the toilet straining for long periods and drank multiple cups of coffee a day. Together, we worked on adding oatmeal and prunes to her breakfast, increasing her water intake and cutting her coffee in half. Within a few months, she was having easier bowel movements and fewer bladder accidents. She told me I never realized my bathroom habits were training my body the wrong way. Now I feel like I have control again. Her experience shows that simple, consistent changes can transform how your pelvic floor feels. Posture and positioning during bathroom visits also help. When using the toilet, try placing your feet on a small stool so your knees are slightly higher than your hips. This squatting position straightens the rectum and makes bowel movements easier, reducing the need to strain. It's a small adjustment, but one that protects your pelvic floor from unnecessary stress. Similarly, taking your time instead of rushing helps your muscles relax and work more naturally. Managing bladder and bowel health is about being gentle with your body. Instead of forcing or straining, support your pelvic floor by making it easier for your body to do what it's designed to do. Think of it as lowering the daily workload of your pelvic floor. Just as you wouldn't ask a tired friend to carry all the groceries alone, you don't want to constantly burden your pelvic floor with pressure it doesn't need to bear. So the fourth everyday habit is to protect your pelvic floor by preventing constipation, avoiding unnecessary bladder strain, and using supportive bathroom habits. These small adjustments, when practiced consistently, make a big difference over time. In the final part of this video, we'll bring everything together with the fifth habit, listening to your body and seeking support early, so you can stay confident, independent, and strong well into your 60s and beyond. The fifth and final everyday habit to protect your pelvic floor after 60 is listening to your body and seeking support early. Too often, women ignore leaks, heaviness, or pain because they feel embarrassed or assume these problems are just part of aging. But silence only allows issues to worsen. The truth is, your body often whispers before it shouts. A few drops of urine when you sneeze, a subtle sense of pressure in the pelvis, or discomfort during intimacy are early warning signs that your pelvic floor needs attention. By listening to these signals and acting early, you prevent small problems from growing into bigger ones. Many women delay seeking care because they feel alone or ashamed. Yet urinary leakage and pelvic floor weakness are incredibly common. According to the National Institute on Aging, more than half of women over 60 experience some degree of incontinence. That means you are not unusual, and you are certainly not alone. When you talk openly with your doctor, you open the door to simple solutions, whether it's learning proper Kegel technique, using a pessary for prolapse, or trying physical therapy to strengthen pelvic muscles. Early action often prevents the need for surgery later. I recall a woman in her early 70s who endured daily leakage for years. She wore pads everywhere and avoided travel, because she feared accidents. When she finally came to see me, she admitted I thought this was just something I had to live with. But after a few months of pelvic floor therapy and consistent Kegels, she cut her leakage in half. By the time we followed up a year later, she was enjoying outings again without fear. She told me I wish I hadn't waited so long. Her story is a reminder that help is available, and the sooner you ask, the more options you have. Listening to your body also means respecting its limits. If you feel heaviness after lifting something heavy, don't push through, pause and rest. If certain exercises make leaks worse, modify them. Trusting your body's feedback helps you adjust habits before damage is done. This is not weakness, it's wisdom. After 60, protecting your pelvic floor is about working with your body, not against it. Think of your body as a trusted friend. When it speaks, it's guiding you toward care, not criticizing you. Support goes beyond medical professionals. Talking with trusted friends, joining women's health groups, or engaging in online communities can reduce isolation. When women share their experiences, they often find comfort in knowing others face the same struggles. Community also provides motivation. You're more likely to stick with healthy habits when you feel supported and understood. So let's bring everything together. The 5 everyday habits to protect your pelvic floor after 60 are practicing Kegels, consistently maintaining a healthy weight, staying active with low-impact exercise, managing bladder and bowel health, and listening to your body while seeking support early. Each habit alone is powerful, but when combined, they create a strong foundation for lifelong pelvic health. With these habits, you can reduce leaks, prevent prolapse, and preserve your independence and confidence. Thank you for spending this time with me. If this video has been helpful, please share your thoughts in the comments. What habit are you most ready to start today? Your story may encourage another woman to take her first step. Share this video with a friend or sister who might benefit, and subscribe to Elder Care Wellness for more trusted, compassionate health advice. Remember, at any age, your pelvic floor deserves care. By protecting it with these simple habits, you give yourself the gift of freedom, strength, and dignity in the years ahead.